in 2022. I'm Maria del Carmen, your host. I want to welcome Dr. Lucinda Canty. Dr. Canty recently received her PhD in nursing from the University of Connecticut. She's a certified nurse midwife, maternal health consultant, a published author, a poet and artist, and entrepreneurial, and I don't know what else I didn't capture, but I think I may need a second show to talk about the rest of her careers, but we'll give it a shot here today. I have the honor of knowing her as Lucinda. Lucinda, welcome to the GyrlSense family. It is my pleasure to have you here, and I am really, really, really from the heart honored that you are here. And I say that because, interesting enough, you recognize that you have an impressive resume, yet it's not what you most value about yourself. So I'm going to pass the microphone to you. So tell us about who is Lucinda, where are you from, and what do you value the most?
Hi, everyone. Thank you so much for having me. So oh my God, I'm a mom. I was born in Hartford, grew up in Bloomfield and Windsor pretty much my entire life. Left a little bit for school, but always came back. I love this town. What I value most is that I'm a Black woman, and I love everything that comes with that. I can't even see myself as being anything else. So I teach, I provide care. I'm an artist, like you said, a poet, but I value myself first as being a Black woman. And I just love everything that represents.
Very beautiful. And there's a skill with that. And it's not a skill that you learn. It's a natural ability to recognize that. So many, I don't knock people's accomplishments. They worked really hard to where they are, but no later than 2 or 3 seconds into meeting the individual, or I don't know, it could just be, how's your day going? You very fastly, you're like, bang, 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 So I appreciate your humility and your humbleness behind that. So yes, it is great to be a Black woman. Speaking of being Black, we are in the midst of Black History Month. I know you are extremely passionate about racism in nursing. Yeah. Now, this could take us for days. I know it can. I did do a little research once, a long time ago, and I'm sure you probably know readily, the vast difference in care from nurses, doctors, etc., when it comes to caring for people of color in general, in the medical environment. And then you have that subcategory, right, of maternal care, which doesn't mean it gets any better because it's a magical moment, right? So the question is, you can tackle anything that I've already said, but the question is, did you know going into nursing, you knew of racism, yes, but did you know of its existence before you got into nursing, or was that, if you knew, was that the reason why you got into it?
Yes. So I thought when I was in, just growing up, I thought I understood what racism was through school, through my education. I thought I knew, I had an understanding, but it was not until I became a nurse that I really understood racism. Okay. It's like you're so innocent to it. And I was 21 years old when I started practicing, and I knew racism existed, but I always thought that, okay, she could be home, she could be racist at home, but when it comes time to take care of patients, that was thrown out. And I look at the patient as being human. I'm gonna do my best to provide care. And when I entered nursing, and I always say this, nursing gave me a PhD in racism. I learned about personally mediated, I learned about structural, and I learned internalized racism. And I was a victim of all three because I was so unprepared. It's like you see things happening and sometimes you don't really even understand it. You know, people still think it's about using the N word or it's about, you know, you treat someone wrong or they have a bad day, but it's so much deeper than that. And that's what nursing taught me. Nursing really helped me see that people can be treated differently, and especially when they're at their most vulnerable time. Because I had a friend that was like, racism is everywhere. But I'm like, but as a nurse, you're at the bedside, you're taking care of them when they're their most vulnerable. You know, there's no place for that because that's how come we see the disparities that we see. COVID opened our eyes up to that, but a lot of us knew that already. But I have to say that you kind of go through life seeing it, but not really understanding it. And then I think that whole other layer of internalized is you feel like you can't do anything about it. So I would say that through the years, I started to learn and try to find my voice, but it wasn't until I was victimized really several times. It really took when I went back to school. So, because I started teaching, I teach nursing students, nurse practitioner students, and I actually even fell into that. I thought I was going to do just a semester, do a clinical for maternity, and then be done. But I loved it so much. I love having that fresh nursing student come and they're terrified, and then at the end of the semester, they have confidence. So I love being a part of that. But I had to go back to get my doctorate degree and always wanted to, never thought I would, but that's where I really learned about myself and what it was to be a nurse. Because I saw myself that I could be part of the problem or I could be part of the solution. And that put another layer on racism for me. Because even through the process, like nursing education, nursing has a lot of racism, and we're trying to work on that right now. But it's like it starts with nursing school. And you know what, and I even want to back up. It started when I thought about becoming a nurse. You know, I applied for, you know, to nursing programs. It started with my guidance counselor. And I applied to the schools already, but met with him after. And he was like, oh, you know, I don't know if these schools are going to accept you, but the community college, they'll accept you. So I went home thinking I applied to all these schools. The community college is probably the only one that's going to accept me. But what if they don't accept me?
Right.
All the schools accepted me except for the community college. They put me on a 2-year waiting list. So I always say, you know, I'm very spiritual. I always feel like God lets you see things. So I was grateful that I applied to the programs before I saw my guidance counselor. And then, so because 2 years later, I started out at Hartford College for Women. It was a small junior college that they're closed now. University of Hartford took them over. And I went to Columbia University. And when I was like ready to leave, I get a letter from Capitol saying, oh, welcome. I'm like, this is 2 years later. And I had a moment, I was like, what would I have done in those 2 years? I didn't know what I was going to do. So I just feel like things happen for a reason. So, but throughout nursing school, I feel like I had a good education from my undergrad, graduate, but I was in a lot of spaces where I didn't see myself. I didn't see other Black nurses. I didn't hear about our history, our contributions. I didn't hear about contributions of any culture. The only person I heard about was Florence Nightingale, and that was it. And I'm like, was Florence Nightingale taking care of Black people back in the day? You know, what was she doing? Because I'm like, who was taking care of us? Who was delivering our babies? Who was nurturing us? And that's when I learned this history that I learned years after I graduated. Like I learned about Harriet Tubman, and every day I've been posting something on my social media because I want people to know we have a rich history. So that was my thing of going through school, not seeing myself. But it wasn't until I was looking at researching for my PhD, because I wanted to look at maternal health and health disparities. And I was looking in other countries. I was looking at Somalia, because I was looking at countries where there was like conflicts. So I want to know how were pregnant women cared for. And then I was in a discussion board, and someone was like, come back to America, take a look at Black women. And when I saw those statistics, it's like when you're working in it, you don't see it. But for me, it was like I was stepping back and I could see all the disparities. And everyone knows that, or should have heard the numbers, like Black women are 3 to 4 times more likely to die from a pregnancy-related event, twice as likely to come close to dying. And so I want to know why. Why are Black women dying with all these resources we have? And when I first started looking at the research and talking to people, their first thing was, oh, she's poor. She starts prenatal care late. She has a lot of diseases. She's obese. She's not married. I even heard that she's not married. But I was like, those are not the Black women I know. And I've worked in a lot of different settings. There's not a Black woman that I haven't cared for. And I'm talking about socioeconomic background, their education. I'm like, I don't know these women. I'm like, but my friends, one friend had preeclampsia where her blood pressure was very severe. That was very, she was life-threatening. But I was like, she started prenatal care early. Mm-hmm. So I was like, I can't, and everyone was blaming the woman. So I said, I want to find out. So I interviewed women who almost died. And I came out with a different story. And research, nobody likes to talk to Black women, but everybody wants to tell us how to take care of our bodies and what to do with our bodies. So that's an issue in itself. But I found that women were starting prenatal care early. One woman I talked to, I think she started prenatal care at conception. They couldn't even see anything on the ultrasound. So she was very early. They all started early. They all had from high school diploma up to doctorate degree. They had insurance. They had access to care. It wasn't like they had barriers. So they had all those things and they still almost died. And I look further and even Serena Williams, I'm like, you could have all this money, you could be physically healthy and you could still almost die. So I knew that there was more to the story. And what I found is that, race is a part of it, but also how the healthcare provider treats women when they're pregnant and during childbirth, and even what we do after postpartum. So I saw all those pieces and how women who felt like their providers cared about them. One woman said, oh, just call me anytime. Any problem is a big problem. I don't care how small you think it is. So when she started having some warning signs, she called right away and was told to come in. But then I saw the other side of that. Like I spoke to a woman who had her baby. She was about 10, 11 months postpartum, started having chest pains in the middle of the night and went in to the emergency department, was told, oh, you just have a little angina, which there's no such thing as a little angina because angina is chest pain. So something's causing that, but just dismissed it like, oh, just go home, rest, you'll be fine. She was getting dressed. Another doctor came in. She thinks that the nurse who was caring for her went and got help because she didn't like, I guess, what was being seen, but she said she doesn't know. Doctor came in and said, don't go, we need to do more tests. When they examined her, she was in heart failure. Her heart, the normal injection fraction is like 60%. That's like how well your heart is pumping. She was functioning at 10%.
Oh my goodness.
That they had to admit her to the ICU. She told me, I don't know where that doctor came from. If he didn't come in my room, I wouldn't be talking to you right now.
Yes.
And yeah, so I'm just saying, like, she had reported the symptoms, she was in for care and was dismissed. And that unfortunately is a common theme.
And you would think that this is, I don't know, 50, 60, 80 years ago, or longer, but we all know that it's still, as you mentioned, those most recent
happening right now.
Current of events. Yes, there was so much there. Let's start off when you mentioned that you are posting something, every month with regards to Black history. This is actually the first year I didn't do it. This is the first year I didn't do it. However, I did have my collection to post. I don't know what about me felt not to do it, but I didn't do it. I did the whole Kwanzaa thing. But what I did learn this year in my research was, and this is completely appropriate, I had no idea. Let's not even never mind the care for uh, people of color, but how much people of color contributed towards the medical devices and tools and services and everything that is used today and has not been given credit where credit was due. And one simple thing was the menstrual pad. I did not know that the creator of the menstrual pad was a Black woman. So, you know, if you think how large and worldwide and globally that is,
yes,
who knew? Who knew that that
exactly.
was, you know, that it was someone of color? And isn't that the truth about any industry? But you know, who knew that it was, you know? But as you also mentioned, things that we learned in our late 20s when we finished school and things like that. What if I had learned that in 5th grade? Right? Why didn't I learn that in 5th? Again, yet another thing. Why didn't I learn that in 5th grade or 6th grade or whatever? Not knocking the rest of the American history, but as we continue to say, Black history is American history. So I take that to light. I personally also have experienced experienced and witnessed over and over and over again, for the simple fact, you know, I've been in an emergency room where, you know, at a glance, if I'm the patient. If at a glance, you would think that I'm fully African American. So they're not, you know, aware that, you know, I have a Hispanic background. But I have witnessed a Hispanic family member come in, you know, telling the story, why don't they feel good and so forth, and being dismissed, being very dismissal to them. And then they'll say, yeah, you know, go ahead and sit down over there. And then, you know, they would say things and really not really trying to whisper. Not, but you know, oh, you know, they always come here. They're just very loud and they always complain about everything, even if their nail hurts or something. But it's the stereotype, you know, when the Hispanic, and like you mentioned, you know, a Black individual. So it's just the saddest thing. And then you mentioned COVID as well. It's the saddest thing is still going on. So I really appreciate your work that you've been doing. So you can continue with your dialogue with this, but you tell us something or tell us some of your accomplishments in moving this needle, in bringing the issue to light. I know you have plenty to tell. And how has it benefited the community?
Okay, so one of the things that, again, through my, like I was doing my research, and a lot of times, like you said, sometimes we enter a space and no one cares like where we came from. They just see skin color and they know everything about us. They know what we're thinking, where we came from. It's amazing without even talking to us first. So again, and I'm saying like a lot of my kind of awakening started when I was in my program, because I almost felt like I was fighting to get out of my program. I'm like, I'm doing the work, but it's just like there was something new to add or something else I had to do, or someone didn't take me seriously, that I had to become strong in my work and show that I was passionate about it, but also show that what I'm doing is important work, because we have to look at maternal health. There's no reason that a woman should die during childbirth in the United States with all the resources we have. So it was like, through my own experience, it started with me fighting to just graduate. So I was able to do that. But then COVID hit, and then George Floyd and Breonna Taylor. And it was like all these things that just kind of built up, that I'm like, you can't be silent anymore. You have to start talking about what the issues are. That I didn't want to be that person in the background anymore that saw things, didn't understand. I wanted to be able to understand so I could speak up and talk about them. So one of the things that kind of came out of all this work were two nurses, they were two white nurses who approached me that they want to do something to address racism in nursing. You know, everyone was touched by George Floyd. And for me, it had like a, and I know this is true for a lot of mothers, but you know, I have a Black son. And I'll tell you the story. This is, and again, it was my fault because I was speeding a little bit. I was speeding a lot. I won't say a little bit. And I have my son in the back.
You and me, no one else is listening.
I'll just say a little over the speed limit. But I got pulled over and my son was like, "Mom, I'm scared." And when he said that, it just like broke my heart. It like, I wasn't even ready to fight the cop. I was gonna say I wasn't speeding when I knew I was. But when he said that, my heart just melted. And I just think, you know, seeing George Floyd, even though he's an older man, I was like, that could be my son. So I'm like, no more am I gonna sit. And with COVID, hearing about people going in, a person of color, and they have a cough. We know COVID was, you cough, but they were sent home with cough syrup, or they were sent home to rest and just spread it to everybody else, and just barely if they did make it back to the hospital. So I'm like, nurses are all at the middle of all of this. So we have to do something. So when they came to me, we wanted to do discussions about racism in nursing, and no one has really talked out loud about this before. And so we set it up where, you know, I wasn't going to do a class. I just want to talk about my experience. And what was driving me was that I hear stories from people who are going through things that I've heard of 30 years ago, that are still going through the same, with a professor that's singling them out, with them not feeling heard in their classroom, with them not even being encouraged to go into nursing or into midwifery. So I'm like, that narrative has to change. And I wanted people to know, we ended up doing a 5-week web series called Overdue Reckoning, Addressing Racism in Nursing. And we didn't know who was gonna come. We just knew that we had to do something. And I was like, even if 5 people came, that's enough for me. Because there were so many things I wanted to talk about and get out. And so we ended up having about 120 people who came every week for 5 weeks.
Wow.
And what we did different in this group was only women of color, nurses of color could talk. White nurses could ask questions, but could only ask questions in the chat. They couldn't have the floor because this was our first time talking about it. And there's so many times in our experience where we tell people what happened and someone's like, "Oh, I don't know," you know, or, you know, someone will say, "Oh, you know, that person is so nice. Are you sure they did that?" So we didn't want people to be dismissed, because to think about what you've experienced is painful, it's traumatic. People don't realize it's not just about us having a bad day, that when these are like racial insults that we experience that really hurt us to our core, we keep moving, because if we focus on every single thing, like if I go to the store, I'll have somebody following me around. I'll have someone, you know, I give them my $20 bill, they're trying to see, is it real? You know, I use my debit card. Is that her real debit card? You know, so it's like, we always experience that. So I wanted an environment where we could be okay and just letting people know what we went through. And I started by sharing a story about how I want to go back to school to become a nurse midwife. And I went from being an exemplary employee, because I asked my nurse manager for a letter of recommendation. And I went from being exemplary to being needs improvement in one day. And it was a nurse, it was a white nurse that told me, she was like, "Lucinda, tell her you're not going to school now, and I'll write your letter for you." And so she ended up writing, I told my manager, I was like, "I'm gonna wait." She was like, "Oh my God, I waited 10 years before I went back to school." And when I saw her happiness with me saying I didn't want to go, that's again when I start to realize, okay, I got it. And the other woman wrote a letter for me, and I did end up getting accepted into a midwifery program. But when I shared that story in the chat, I used to say, when I shared that story in this session, it was our first session, the chat went wild, and nurses want to talk, they want to share their experiences. We've had different cultures, different races, just start talking about what they went through. And it was like a part of us really healing and realizing that we weren't alone. So that's one space that I'm in, is really looking at, you know, addressing, you know, the oppression that we see in nursing, and giving people the opportunity to know that you're not alone. You have support. We'll help you get through these difficulties. You know, we'll go with you if you need to talk to your professor. Or, you know, I always tell people, look at your policies. Are they violating the policy? And you bring that to them. And that has de-escalated in itself a lot of situations. So it's really just about, because if the nurses aren't feeling safe in their practice, they're not feeling supported, that impacts patient care. Nurse, and you don't value that person coming in for whatever reason, because most people, when they enter healthcare, even if they have a paper cut, they're coming in for help. They're coming in because they're afraid and they're vulnerable. It just takes a minute to talk to them and see what's going on and where they're coming from. It just takes a minute. And I feel like everybody deserves that. So I do a lot of kind of advocating. I do a lot of information to let people know how it looks, you know, how you set up policies and how that excludes people who look like me. So that's what I spend a lot of time doing when I look at racism in nursing. But what I also do is just educate people so that they understand diversity and what that means to someone's health, and why we need diverse spaces, or we need a space where people who could come in, regardless of where they're from, they know that nurse is going to make sure they have what they need. They're not going to look at them and judge or tell them what they need. I'll never forget, and this was actually a patient that I had, a woman of color, and she came to see me for her yearly checkup. And she was talking about her provider, when she went to see her primary care, she was like, he kept telling me what I need. As my body, I know what I need. Let me tell you what I need. And that really rang true with me, that's how we should be in spaces. We have to find out what people need so that they could be healthy. We have to find out why they're coming in. And we can't judge them. It's almost like that doctor that told a woman in my study, any problem is a big problem. Just come with me and we'll figure it out. And that's always how I also wanted to provide care to women. I always think, what if that was my little sister? What if that was my mom? Or what if that was me? How would I want somebody to treat me when I come in? So that was important to me. So we still do talks. We don't do it weekly like we used to. We meet like once a month.
Okay. You know, the amount of, still today, you'll have professionals in very, you know, highly ranked in the ladder still say, oh, that was an incident. Or that, you know, they'll classify it, oh, that was like an unusual incident. You know, let's just treat it. They'll treat it in that form. But the reality is, partly what you said, this has so, you mentioned policies. This goes in, it's like in the veins of medical care, of medical environments, right? So it has to do with roles, you know, professional roles in the medical, you know, who is depicted as, you know, a person of color going for a director role in nursing, or vice president role in nursing, or whatever the higher rank role in nursing, right? So we know that it's just there, and for many reasons that they're not either qualified or don't get the position. So it's so much more beyond the bedside in medical care. You know,
Yes.
it's in or it's not in policies for the most part. You know, now DEI, diversity, equity, inclusion, and belonging is just a sexy thing to say. You know, it's everywhere. It's fine. Everyone wants it as part of their organization.
Yes.
But it's so hard to implement it because you still have these biases. You still have, you know, and people are just, it's just complete friction. And and even in that environment, the, you know, the people of color still don't have a say. You know, we're there. It's the white, you know, staff, whomever leaders that are telling us how to run the show.
Yes.
You know, so and it's just they're not listening. And if they listen, if that turn, they'll just turn the event into they'll just classify it a little different, and it's not a problem. It's
Mhm.
just,
Exactly.
categorized as an incident per se.
Mhm. Exactly, exactly.
Right?
And that's a problem that, and I can talk about from the nursing piece, is that it's so rooted in our history that when you
Mhm.
look, like I'll talk about midwives, there were traditional Black midwives who came from Africa, who were in the Middle Passage, providing care, delivering babies, providing care. And, people are always like, oh, slavery is in the past. But I'm just going to show you how those same things that started then continue to be perpetuated today. So even during the Middle Passage, they're delivering babies, then when they're on the plantations, they're delivering everybody's babies and providing care, providing nursing care, midwifery care. And then when nursing programs start to be established, suddenly our brains were not smart enough to be a nurse. And I still think that that thought process is still being said today. It's just another way of saying it, like SAT scores or chemistry grades. So they find another way to exclude us. But it
Mhm.
started at then where they were like, we weren't smart enough, but we were doing it already.
Right.
And because I'm like, who was taking care of people when no one else wanted to touch them? Or they couldn't go to the hospital down the street. They were the midwives in the community, and they were painted as being unsafe for women when really they were the heartbeat of the community. There was even a sense of community around births, and then, transitioning from home births to hospital births, it was like, they were promised that we're going to take care of you, you're going to be safer. But when you really look at the history, more than what's in our nursing textbooks, you really see that women weren't safe, that the doctors had higher maternal mortality rates than the midwives who are working in the communities. They would go into homes that didn't have electricity, that didn't have running water, and still give safe passage for these babies. But it's like, that's that history that's taken away.
Mhm.
And then the other part of it is the pain. Like, I want to show you pain is that thread to show how implicit bias still exists today. Because even
Yes.
then, we had Dr. Marian Sims, who was practicing on slave women's surgeries with no anesthesia, because there was perception that Black women didn't feel pain, so it's okay for me to do that. They don't feel pain, so it's okay for them to deliver a baby and go back to working. Or they don't feel pain, they don't love, so we could take their babies and separate their families. So we're still dealing with some of those issues back then. Because even the nursing textbook, it says that Black and Hispanic women are more likely to exaggerate their pain. This is the nursing textbook. A new
Yes.
edition just came out, so I didn't look at it yet. I don't want to get my blood pressure up. So, but they allegedly said they were going to take that out. But those are what people are reading. I have to tell you what they said about Asian women. Asian women are very quiet when it comes to pain. This is the textbook. The first time you ask her if she's feeling pain, it's normal for her to say no. So you got to ask her again. My friend who's Asian said that's not true. She don't know that woman. So anyway, but that's what the textbook says. So then you have that student who's probably never come in contact with a person of color. They read that and that's what they think and that's what they bring to their practice. They
Mhm.
still bring in that we're not smart enough to be nurses. They're in their classrooms. There is lack of diversity in their professors. Then when they go into the hospital, it's like for nurses, especially nurses of color, we can have roles where we're doing the heavy lifting. When we have that patient that's withdrawing from substances, we could be thrown in there. Or that patient that needs around the clock care because they need total care. But when it comes to leadership roles, they try to say, oh, we can't handle that. We're not smart enough for those roles. So again, it's the same thing over and over. But we're not smart enough, but then you could have 30 years of experience and they'll get a new graduate and say, oh, but she could do that role.
Yes.
Who's never touched a patient, who's never doesn't know what it is to be in a leadership role. So there's a lot of inequities there.
Mhm.
And these diversity statements, they look pretty on paper, but they're also designed to make the same people who are promote lack of diversity, who exclude people of color, they're the ones who are writing it. And there is written so that they don't feel a certain kind of way.
Right.
That everybody's happy. We're happy. We recognize that everybody's different. Everybody's happy, but they're not practicing what's on that paper. And that's what we see over and over again. We're starting to break through as we're learning, like the Georgetown University is going to have a dean, a Black dean of their nursing school. that she's going to be the first one, because they were with another school and now they're going to be separate. So she's going to be the first dean of that school. We're seeing people who are in roles, leadership roles, like Enid Williams at Yale New Haven Hospital, who's a nursing CNO. So we're starting to break through, and we're showing people that we can do it. But it's just the things that we have to do to get there. I always feel like we start at the bottom and then we have to prove. It doesn't matter what education you have or whatever, we got to prove that we can do. We got to move up. When other people, they start up and then we see how little they know and they move down. But we have to wait. It's like, how long do I have to wait before people see that? You know, that's part of the problem. But it's those old beliefs. And if you don't have to change, you're not going to change. If no one holds you accountable, you're going to keep treating people a certain way. You know, and that's a problem in our healthcare system. We need more accountability when someone mistreats a patient and not say it's an incident. Oh, just write it up as an incident. Or sometimes, you know that there was racism involved, but then you're so beat up by the system, you're like questioning yourself. Did I really experience that? You know, did I lose that promotion? Even though I've been working in nursing for 40 years? So it's like you start questioning yourself when you know that it's wrong, but that's how the system is set up. It's set up to make us believe that, you know, these things that are not true about who we are.
And when there are breakthroughs here and there, peppered here and there, one does have to ask, are we just checking a box? How long will this stay?
Yes.
You know, so time will tell, you know, if it continues, if they continue to fill different other leadership spots, but only time would tell. We're not saying we're not going to take the job, but
exactly
because they need us. They need us in those roles so that the person that comes in through the emergency room isn't judged by the level of how they express their pain. And I have heard that over and over and over, that description between the Hispanic and the Black and the Asians and the level of pains, that is like 101, right? Common 101.
Yeah.
So there's a lot of things that through a terrible or a tragedy or a trauma that we've experienced, whether we're talking about 2017, 2016, those 4 years, or whether we're talking about George Floyd and, you know, forgetting the name, Ahmed, or Brianna, right? Because of those incidents, right?
Yes.
Terrible for us that it took place, and many true colors came out, you know, in and of itself. But I have to say that there are a lot of good that came out of this. For instance, you mentioned those 2 or 3 white nurses who expressed that they wanted to do something.
Yes.
You know, unfortunately, all the other times before, you know, that somebody may have made a complaint, whether it was an employee, whether it was you know, a patient, wherever you fell, you know, in the ladder, when they would come forward and make a complaint or express a concern, for whatever reason, it didn't click. But
and
you know,
yes, and that's
right?
and that's the thing. That's why when we had these talks, you know, and there were white women who were like, I didn't know I could, you know, I didn't want to be quiet, but I saw the value in that. Because some women were like, and these are nurses who've been, some of them practicing for years, said, I didn't realize I caused harm. Some of them said, even I saw things and I didn't say anything. And I realized now the impact that had on the other person. So that's why we have to have these conversations, because that's how we get to the root of the problem. And I always hear people say, oh, they know better. And some of them know better. Some of them know they're causing harm, but there's a lot who are never in spaces to have the talks.
Right.
You know, they're afraid or they don't see it. And it's just really about getting people to see how it's real, but also the harm that it causes.
Yes.
That, you know, I could think of incidents that happened to me, like even with my nurse manager, that was like 20 something years ago. But I still remember how it made me feel, the pain that I felt when I'm trying to do the right thing. That I don't think it will ever go away. I think now though, it's,
That's going to
yeah.
be your motive. That's your incentive to keep doing what you're doing, right? Because each one of us, and I think, you know, just in general, just people, humanity, right? It's that one thing that someone said no to you, or that can be that thing that motivates you the most.
Yes,
So sometimes being told no, it actually is the thing that you need so that you can go up to the next level and prove not them wrong, just prove yourself right.
Yes,
Right?
yes, yes. And let other people see that you don't have to accept that no. You know, you're seeing that guidance counselor that's like, oh, that community college is the only one that accepts you. And I have nothing against community colleges, but I'm just saying for you to say that that's my only option, that's insulting to me.
It's very insulting.
You know, so I want that student to say, you know, no, I don't have to say that. You
Yes.
know, I want that student in her class, they're talking about Florence Nightingale. Well, I want to talk about Harriet Tubman too. She was a nurse. So I want that. That's where I want to see the change. And even the thing that happened to me that touched me to my heart was I did a talk, it was for doulas. And I was talking to some of them want to be midwives. And one I was saying, you know, well, your experience of giving birth can place you in that role of caring. You know how it feels to be treated a certain way, how to be treated good, how to be be treated good. That's the making of a midwife. And at the end of the session, she said, Lucinda, no one has ever told me that I could become something. That it broke my heart to the core.
Wow.
So someone who has experience.
Just for the sake of, so that everyone understands, give the definition of what a doula is. Because I remember maybe 20 whatever years ago, someone kept telling me doula. I'm like, I don't know what you're talking about. What is is that a dance?
Yes. Doulas, and I'll talk about midwives, but doulas are women who have training in how to, they're not medical healthcare providers, but they have training into providing education and support to women from pregnancy, childbirth, postpartum. There's even doulas that specialize in grief or loss. So there's a lot of things, but they're not nurses and they're not doctors. So they're not healthcare providers, but they still have the training to offer support. To me, it almost reminds me of like traditional midwives back in the day, that they had the, you know, they didn't go to a formal school, even though doulas have to go through a formal educational process. But for women, for example, traditional Black midwives, there no educational, they couldn't even get a high school diploma, but they learned their trade through working with women from the community. And they gave such a strong and valuable support. So doulas are, they could be, you could have them anytime during your pregnancy or during your labor. They could be with you the whole time while you're during childbirth. And then they could also offer services postpartum. And there's really a lot of education, a lot of support. So midwives can have either a nursing background, like I have nursing. I didn't learn about midwifery until I was in nursing school. But then there are midwives who don't have the nursing background. So there's a lot of different sections, but we're considered more healthcare providers only because we have the medical training to deliver the baby, where doulas don't deliver the baby, but they offer, again, a valuable support to women. And again, help them throughout the pregnancy and caring for the baby when it comes.
And again, had you not been in your role, a Black woman, to tell someone else, oh, you know, you could do something else with this.
Yes.
We can really count on that if it wasn't for someone of color to express that, you know, instill that interest in the individual, which is why they don't want to put, you know, which is why there's a lack of people that look like us in those leadership roles. You know, it's a method to the madness, right? Because if somebody there, then we're going to have to change our everything. It's going to be a domino effect because that person is there, right?
Exactly. Exactly.
So it's fair, but it's a great segue to, you were speaking of midwives, and this is where my complete ignorance is going to come in. So I'm just going to put it all out there. But if I have these questions, maybe somebody else out there may have the same questions. So, boy, have you mentioned, midwife? I heard midwifery.
Yeah,
I didn't even say
midwifery.
that right. I'm sorry, my tongue won't roll that way. So still today, when I hear midwives, right, my wired brain somehow brings me back to Little House on the Prairie. So I'm thinking, oh, I know what a midwife is, but why are we talking about midwives in 2022?
Yes, yes. So
So what
yeah,
is the percentage, right? What is the
yeah.
percentage of women who
In
do?
Connecticut, there's not, I don't even have the statistics in front of me. We're still a smaller profession. And we're like, for myself, I'm an advanced practice registered nurse that specializes in midwifery. So I can see
Okay.
patients independently. A lot of times when people hear midwife, first they like, I don't want a midwife because I want pain medicine. Or someone's like, I don't want a midwife. I don't want my baby at home. So there
Yes.
are midwives that deliver at home and there are midwives that deliver in the hospital setting. And I've
Okay.
delivered in the hospital setting. So I've never done a home birth,
Okay.
but we have our ways, like there's a medical model that focuses a lot on disease and complications. Midwifery focuses more on natural births and trusting the body to do what it's supposed to do. But if a
Mhm.
woman wants an epidural, she could get her epidural. If she wants pain medicine, she can have her pain medicine. So it's not like we keep that from her, but it's just that we make sure that whatever she's in the home, we're just making sure that she's safe in how she's providing, delivering her baby. So we don't
Okay.
have a lot of home birth midwives, but it's growing. But I want to say it's growing in Connecticut.
That
We're
was my
different than
next
other
question.
states.
Yeah, that was my sub
Mhm.
question. Has it always just been a steady thing, or have you witnessed it increasing or decreasing? I know
I want, yeah.
so many, and I think it's
Mhm.
you know generations. I guess I think of maybe in the '60s or early '70s. I can see it happening more there. You know what I mean? Because I think
Yeah.
that because of the time, of age, I can kind of
Yeah.
see like the whole integrative medicine type,
Yeah.
mentality.
Yeah. Natural
Right?
childbirth and things like that.
Yeah, exactly. And then I think today it is here. It is coming. It has come back. There's so much in sound healing.
Mhm.
I'm actually registered to go to my sound healing session later this month.
Oh, yeah.
But
Mhm.
but that holistic integrative
Yeah.
medicine type
Mhm.
one-on-one.
And yes,
um,
and COVID scared a lot of women because midwives were delivering in the hospitals, but again, there are home birth midwives. And with COVID, people were afraid to go to the hospital. So there was
yes,
an
that's
increase in home
right.
births because of that.
Yes,
Mhm.
yes, makes total sense. Total sense.
Yes, but
Now,
yep.
oh, go ahead, go ahead.
Oh, just really quickly, we also provide, like right now, I provide reproductive health care. So I'm doing annual checkups, birth control, STD screening, just well checkups. So midwives take care of everything, not just births. There are
Okay,
also midwives, there's midwives who do everything. I was doing that at one time, but now I'm just doing the outpatient reproductive health care.
okay. Where does one study? Is
Yeah,
it part of a nursing school or
it
what?
can be, yeah, it can be. And then there's midwifery programs that are like standalone programs. So
Okay,
since I was a nurse, I went to Yale's program that was for nurse midwifery. But there
mhm,
are programs that focus just on the midwifery piece because
okay.
some people don't want that nursing part. They just want to get into caring for women. So there's a couple of routes to being able to practice.
And is it practice heavily based on, or the women who choose this route, does it lean towards a particular race or religion, or do you see that it's a cultural reason? I mean, I mentioned integrative medicine, but does it
Yeah,
touch on those?
it all depends. It's really across the board.
Okay.
I talked about like the traditional Black midwives, because in some communities, like I want to say like 1950s, I can't think of the numbers right now, but there was no one else caring for those communities. But there were immigrant midwives, and then there were the traditional, they were also called granny midwives, but really
Okay.
they're traditional, Black midwives.
Good.
So, but any community can have them. And, like when we're looking at doulas, anyone can have a doula, but because they're not covered by insurance, people who can financially afford it can have a doula. So there are women who may not be able to afford them. And that's one thing that I'm advocating for, to be able to have doulas recognized as a part of the healthcare team and being reimbursed for the services that they provide, so that they can have make a living off of doing this. So that's, and I think women who want it should be able to get it, and cost shouldn't be a factor. I'll use myself as an example. When after I had my son, his father was going back to work, my mom was going back to work. I want to help. So I called and asked for a doula, and they were like $900. And I was like, I'm working part-time. I don't have $900 laying around, but I regret that I didn't find the money to do it. And I regret that my insurance wouldn't cover it, because I did need that support after I had a cesarean section. So I was still healing. And to be home alone with the baby, it was difficult. It was difficult. So if I had some kind of support, if my insurance would have covered it, I would have had them in a minute.
Exactly.
So it's expensive, but for the work that they do is worth their time.
And if I decide, that I want to give birth at home, how does one prepare? And all I could see is like, a blow up kid pool in the middle of the living room, and me in it. Is that how it is?
It could be that way. There's a couple different ways that it could be done. But you have to find a practice that's willing to do it. And again, there's midwives that are trained that only do home births. Birth and Beyond is one that I'm thinking of. And I think there's one called Roots Midwifery. And they do home births. They specialize in home births. But it's not like anyone could show up saying, I want my baby at home. They do, they assess them. They make sure that it's safe. They look at their medical background. They make sure that the home has everything it needs.
Who's doing the assessment? Like, does the potential mom go to their insurance company? Like, where do they go?
Oh, but they do have to make sure it's covered through insurance. Right. But they're going to that midwifery practice. So they're seeing a midwife who has experience doing home births, and she'll assess to make sure that everything is safe. Safe for the mom. So it's not like people just randomly say, okay, just have your baby, anybody could come. Because a lot of people think that, and they don't realize that when midwives do home births, they're still assessing them. That if there's anything that could be a risk to the mom, they're going to make sure that, and they usually work with a hospital or physician. So they have someone to call if they have concerns. And if there's anything, like, for example, I mentioned preeclampsia, which is a condition where not only the blood pressure goes up, but every organ in the body's impacted. So if a mother's blood pressure is going up, then they would have them have evaluation to see if they could be safe enough to deliver in the hospital. And if they do have preeclampsia because of the risk, they're usually transferred care.
Okay. So
monitored.
After you've given birth in the home setting, do you still have to go to the hospital or no?
No, she assesses the baby. Yep, right in the home. So everyone's assessed to make sure that they're safe. And then the midwife will usually follow up with them. Will still come to their home to do their follow-up assessment. And depending on how,
I find it just like, why, I don't know what I would have done. My son is 28. My daughter just turned 25. I don't know what I would have done back then, but just knowing about it, it just seems so, I don't know. There's a lot of emotion there.
Yes. And someone could still have a good experience in the hospital, but sometimes you get in, it's like so medical. And so, you're looked at as a woman in labor. You're not looked at as her, some people times they don't even know your name, that you're just pregnant and waiting for you to give birth. Yes. So sometimes in the home, especially in your own environment, and your own bed, you can lay in your own bed after. There's just something about that's special.
Something just occurred in my head. So I took that whole magical moment, meaningful moment at home, and then, I'll have my son, and at 13, he probably said, Mom, why was I born in the living room? Explaining to do. I could just see it happen.
And I do have to tell you though, there's some home births where the children are there and they're watching the whole thing.
See, I think
watching
that's
their baby brother.
The bonding right at birth, the bonding right at birth.
Yes.
So we're going to change gears a little bit. We're going to touch upon your artistry. You know, I absolutely love how you weaved in your artistry in your day-to-day profession. You know, how long have you been doing your paintings?
Yeah.
I have realized that most of your paintings, unless I missed a few, are women of color, and the theme is always around
Yeah.
maternity. So, why was that so important for you to showcase in art form?
Yeah, so I've always loved art, but when I started nursing school, everything is just the sciences. It's like you don't have time to have a life, but it's always been something. Art and poetry have always been things that would relax me, just kind of decrease stress. It had me, and also too, there was a time when, Black art was so expensive, and I was a student, I couldn't afford it, so I used to do my own art. And I would have women that had, I should say friends that would have a baby shower. So I would paint them a little picture. But I was also very kind of shy about my art until I was watching, I don't know if it was Nikki, I think it was Nikki Giovanni. And she was like, anything that comes from you is your perception of it. So if that's your art, then it's beautiful. And I was like, so I started to get my confidence in that. And then even my poetry, I would read in private spaces. And when we did the overdue sessions, I read a poem at the end. And at first we were going to use a poem by Sonia Sanchez. I love Sonia Sanchez. But I told them that I do a little poetry, and they were like, "Oh, Lucinda's going to write the poem." And I was like, "What?" It was like they just put me on the agenda. So I was like, so I just started reading my poetry out loud, and then I just started also just showing my art as well. In like there's a recent issue of the American Journal of Nursing. There was an article that we wrote about the program, and they used one of my art pieces on the cover.
Oh,
So
it's
it was
how
really, yeah, it was
special
really
is
nice to
that?
see.
How special, is that? Amazing. Um, Also, recently you announced that you were awarded a grant, and maybe you spoke
Oh, yes.
about what those initiatives were for earlier, but tell us about what that upcoming new venture is.
Oh, okay. So what I'm starting is Lucinda's House, and
Okay.
it's an initiative to address maternal health. And I'm taking this approach because I feel like, first, I don't want to always just focus on negative aspects, especially of
Mm,
negative aspects of who we are and what's in our community. I want to show, because even from my own research of talking with women, I learned so much from them and their experiences. So what I'm doing is I'm going to do like individual consultation, that they're still going to see their healthcare provider. And I'm going to just give them a health education to help them make decisions about their care.
okay.
So like I had someone who had depression, for example, and she wanted to stop taking her medication. She was like, the doctor told me, I need to take them, but what about my baby? So I started talking to her about like what's in the research. And I started talking to her. I said, you got to think about yourself and your own body, is that after the baby, you're at risk for postpartum depression. And you
Mm,
want to be in a position to care for your baby. And so I said, well, why don't you ask your provider these questions? So she decided to stay on her medications, but she talked to her provider and he answered questions and said the risks were small with the pills that she was taking. So, and she was grateful for that. So I want to help women to be able to go in and, be able to ask the right questions during their visits. If they have concerns about their health care, like someone called once and was talking, she said, I had 3 C-sections, I want to have a vaginal birth. So we went through and found out the type of incision she had wasn't safe for a vaginal delivery. And that because she
mm,
had 3 in that same high risk kind of incision. And so,
mm,
but anyways, it empowered her because she felt like people were telling her what to do. So I said, well, here's the information. Here's the questions. Ask your doctor to look at your chart with you. So she went in, and when her doctor showed her, I'll just show you really quickly, like on the abdomen, we do like a bikini cut. So the pretend it's the baby, the belly, we do like what's called a bikini cut. But her incision was up and down. And that's the one that's more likely to open up with contractions. But it was about her being able to see that, and her doctor talked to her, not that her doctor was just saying no, but showed her the reason behind it. So I
right.
just want people empowered in that process. Another part of what I'm doing though is I'm going to have what's called the kitchen table. So we're going to be virtual, and then we're going to switch to hopefully a physical space later. But the virtual table, we're going to talk about different issues. We're going to talk about pregnancy, childbirth, But I also want to talk about issues we don't talk about, like miscarriage, infertility, pregnancy loss. And we're going to just sit, just as women, talk about the issues, talk about what we see can address those issues. And if there are structural factors that come up, then I want to devise a plan on how we'll address that. Is it something with how the provider is treating us? Is it a policy that's preventing us from doing certain things, like having a doula? So what can we do on that level as a group to be able to handle that? But I also want to show that there's so many positive things in our community that we're doing. And there's so many things that can help us stay healthy. So how do we connect? I just want things where we can feel good and feel supported and feel safe. Because sometimes we don't feel safe in society overall, but sometimes we go into that hospital to have our baby, we don't feel safe. But what can I have that helps me to feel safe and comfortable? So I have a couple ways where I'm really targeting some of the issues, but my overall goal is I want women to have a good experience.
Yes.
And even in my study, women who had severe complications, when they had a provider that communicated with them, when they had their family there, those things gave them still a good experience. Because women remember, especially when I first became a midwife, everyone told me their birth stories. And it didn't matter. There was one woman, she's like, 50 years ago, my water broke and this is what happened. And, I love hearing labor birth stories. I let her tell me her story, but the way she described it, you would think it just happened last week because we remember that. But I feel like women have the right, all women have the right to say, I had a good experience. I remember how I felt. I remember the first time I saw my son, not have an experience where they're so traumatized that when they hold their baby, they're so traumatized they can't enjoy that moment. And I want to kind of change that narrative and give women what they need. I'm going to focus on maternal health, but I'm just going to look at overall health and well-being, and address it from different aspects.
Boy, if only you were up and running about, I don't
I'm
know,
almost there.
25 years ago, because with all of the subjects, that we touched upon this evening, I saw myself in it. Yep, I was there. Yep, I experienced that. Yep, I was the patient there. Oh, yep, I was the employee there. I was the witness there. It was just like a rewind of my past and putting myself there. But one that's will forever be like front and center is, remembering going in over and over again. I'm like, I don't think that my menstrual flow is normal. Like I wake, this is, pardon me, maybe too much information.
No, this is important.
But it's like, how does I wake up and it looks like a murder scene? So I'm like, this can't be normal. Like this cannot be normal. So you would go in and you would say something like, oh no, someone, I think one of the nurses reached in her purse and gave me a coupon, a coupon for CVS to get the thicker pad. This just happened, so I mean, eventually, I was diagnosed with endometriosis, so like then it went from there, and then it was like I had to have a hysterectomy. But had they listened to me the first time, would I have saved anything? I don't know.
And that's but that's what you're saying. So many people are impacted by is that we say, because even for myself, I was saying that I was having this weird pain before my period came, and the doctor dismissed it. I think she thought I was looking for drugs. And then when I had an ultrasound, I had several fibroids. So, and I'm sorry I'm getting personal, but I just feel like these are things that we have to talk about in our society. But it's like, your body. And there's so many women who suffer in silence because they did tell someone and they're made to feel like, oh, nothing's wrong, you're okay. Oh, don't worry, just rest, you're going to be fine. That's the famous thing. Even Serena Williams was told that after her C-section. She was like, something is wrong. I can't, something's wrong with how I breathe. Oh, just rest, sweetie. You just had surgery. And she had clots in her lungs. So it's like, that's our famous thing. But my thing is that we have to trust our bodies because there's always signs before we have that major event that happens. There's always signs that something is going on. but it's just that we get into the doctor's office and first of all, they don't even want to address it. I never forget, I had a patient who told me she didn't want to see her primary care anymore because she started to say what was going on. He was like, wait, we're going to talk about one thing at a time. So you choose which one you want to talk about today. This is someone going for a physical exam. If you go
Wow.
for a physical, you look at everything.
Right.
But those are the things that we deal with that we leave so unsatisfied, or we leave with that pain until something really bad happens. And then the unfortunate thing is that we still get blamed. Well, you should have
Yeah.
went to the doctor. I'm like, I did go to the doctor. So that's
Right.
why I want to just change that narrative. And it doesn't hurt to take 5 minutes.
Yeah.
And I'll even give you I have my own lesson that I learned this. I had a patient that came in, she was on birth control, and she said she felt a baby moving. And I'm like, there's no baby in there. She's not pregnant because, she's on birth control. But when I said, let me take 5 minutes. It just takes 5 minutes to check her. As soon as I put my hand on her belly, I felt the baby moving. The woman was 8 months pregnant, who was seen for several visits telling people she felt something moving.
Oh my
So that,
goodness.
yes, so that was my lesson that I learned, is that people know their bodies, and it only
Yes.
takes 5 minutes to do a
That's it.
pregnancy test, to put your
Yes.
hand on their belly.
That's
And
it.
so, I saw that for me, it was a lesson learned that you have to listen to what people are telling you.
Absolutely.
And even if everything, you check them, everything is okay, at least they came in and you could tell them, I
Right.
checked everything, we did some blood work, I checked your urine, everything is fine.
Yeah.
But
And it was
there's
not
so
time wasted.
exactly. And that's the thing. That's the
It was
thing.
not time wasted.
Mhm.
Lucinda, we can stay here all day long,
Yes.
but please tell us, we will have it on the screen as well, but tell us, what website or blog that you would want to put out there for people to visit.
Okay.
They can find out more about you, about your work and the services that you provide.
Okay, so my website should be up soon. It's going to be lucindashouse.org. We have a little, if you even look at the site, you'll see that it's under construction, but it will say it's coming soon. I'm
Yeah.
hoping that within the next month. I didn't realize how hard it was to do a website. It's like all these pieces, and then somebody's helping me with it, and they're talking a language I don't understand, but they're like, don't worry, it's going to be up soon. But you can see me, I'm on LinkedIn, just Lucinda Canty. I'm also on Twitter, Lucinda Canty, PhD. So you can find me there as well. And then as soon as my website launches, I'm going to have, and as soon as I'm up and running for Black Maternal Health Week, we're going to have some events. So that's my goal, is to have everything up and running. And in the meantime, though, if someone wants to talk, yes, sorry. Oh, sorry. It's April 11th to April 17th. So that's that week. There's always a lot of activities on a national level to local level, just to bring awareness to issues related around Black maternal health.
Awesome.
So yeah, so hopefully I'll have something.
Blessing. You are a blessing to the community.
Thank you.
You are a blessing as friends. I know we have a lot of mutual friends. You are just a blessing. What a role model for young women, all young women, but especially for young women of color. And again, women of color, I cannot leave without stating and congratulating you for being one of the honorees of the 100 Women of Color Gala this year, class of 2022. It is such a well-deserved recognition. I don't say this to talk about, myself, but I will share that I was in the class of 2019, the 2019 cohort. And what I remember most about that experience, and it goes back to everything that we just talked about, was being recognized alongside those other 99 women of color. That is profound.
Yes.
Right? It is to be in a space where 100 women of color, 100 women of color. I mean, it could be 1,000, it could be 5,000, but 100 women of color being recognized for whatever it is that they've contributed to the community. So if nothing else, if nowhere else we're recognized or seen, we can recognize each other in our own spaces.
Yes, yes. I'm on like I can't wait. I'm so honored to be recognized. So I
And I
can't wait
will
for
be
the event.
there. I will be there because I will also gloat too that my daughter will be in your class.
Ooh, oh, nice, nice.
So I will be there
Yes.
so I can see you walk across the stage as well. I usually attend anyway, but I can see you walk across, so it'll be very special. Lucinda,
Thank you.
anything else you want to tell us to wrap it up?
Well, I just want to say thank you for having me. I think this is such an important forum that you provide. So I just want to thank you for that.
You're much welcome. Once again, Lucinda, welcome to the GyrlSense family.
Thank you.
I'm Maria del Carmen. Please join us again for more GyrlSense.